A Gynecologist's Guide to Safe Self-Pleasure. After 60, 3 common fail to avoid. Have you ever found yourself wondering if the act of pleasuring yourself after the age of 60 is still a safe or even a healthy practice? A great many women never broach this subject, not with their friends and often not even with their doctors. But in truth, self-intimacy is a natural and normal part of being human. And well after menopause, it can remain a deeply important practice for maintaining healthy circulation, supporting pelvic health, relieving stress, and even fostering a profound sense of connection to your own body. The primary challenge is this: the very habits that once felt completely effortless in your 30s or 40s may not serve your body as well today. In fact, if you are not careful, these old habits can quietly cause irritation, significant discomfort, or even increase your risk of developing an infection. I am Dr. Lily Stones, a gynecologist with over 3 decades of experience, dedicated to caring for women just like you, women who want to remain healthy, vibrant, and confident in every single season of their lives. And in today's important discussion, I am going to walk you through exactly how to practice self-pleasure safely after the age of 60. More importantly, I will reveal the 3 dangerous mistakes that I see women make most often. Mistakes that can silently harm your delicate tissues or set you up for bigger health problems down the road. Let me reassure you, this conversation is not about inducing shame. It is about empowering you with knowledge. Because what your body requires after menopause is fundamentally different. Your estrogen levels naturally drop, the vaginal tissues become thinner and less elastic, your body's natural lubrication decreases, and the flow of blood to the pelvic region is not quite the same. What used to feel good can suddenly feel uncomfortable or even painful. And yet the innate human need for intimacy does not simply disappear. It simply asks us to begin caring for ourselves in new and more mindful ways. One of my patients, Linda, a 66-year-old retired teacher, came to see me after experiencing a persistent burning and soreness following any attempt at self-pleasure. She whispered to me, her voice filled with resignation, "Maybe I'm just too old for this." But that was not the truth at all. She was using no lubrication, she was rushing through the process, and then she was neglecting any proper hygiene afterward. With just a few simple, intentional changes incorporating proper hydration, using a gentler technique, and practicing mindful post-care, her discomfort completely vanished. She later told me, "For the first time in years, I feel at peace with my own body again." That is what this conversation is truly about. You are not too old. Your body still deserves your care, your attention, and the experience of pleasure, just in ways that are well matched to the physiological changes of this stage of life. And when you know which mistakes to actively avoid, you can effectively protect your delicate tissues, lower your risk of urinary tract infections, and successfully reclaim intimacy as a joyful, safe, and integral part of your self-care routine. Before we begin, one important note: this video is intended for educational purposes only. It does not and cannot replace personalized medical advice. Every woman's body is unique. If you experience any persistent pain, bleeding, unusual discharge, or anything at all that is concerning to you, please consult your healthcare provider. Your well-being deserves individualized and expert care. So please stay with me. In just a moment, I will reveal the first and most common mistake that women over 60 make when it comes to the practice of masturbation. It may surprise you, but it is one that can quietly inflict damage on your intimate health if you are not aware of it. And before we get there, I would love to hear from you. Have you noticed any changes in how your body responds after menopause, whether in terms of comfort, sensitivity, or desire? Please share your thoughts in the comments. You will quickly see that you are not alone, and together we can make this a safe and supportive space for women to talk about what really matters. The first and most prevalent mistake that I see so many women make after the age of 60 is attempting to rely solely on their body's own natural lubrication. Before the menopausal transition, your abundant estrogen levels kept the vaginal tissues plump, elastic, and well lubricated. But after menopause, that natural moisture often decreases dramatically. What this means in practical terms is that when you engage in self-pleasure without any external support, the resulting friction can quickly lead to irritation, the formation of tiny micro-tears in the tissue, and even burning sensations that can linger long after the moment has passed. These small injuries may seem minor at first, but over time, they can accumulate, leaving the vaginal wall more fragile, more prone to infections, and far less comfortable during any form of intimacy. This is precisely why the use of a lubricant is not optional, it is essential. I often tell my patients to think of it as a fundamental form of protection, just like wearing sunscreen to protect the delicate skin on your face. Using a good quality lubricant can make all the difference between a painful, frustrating experience and a safe, enjoyable, and deeply pleasurable one. Water-based lubricants are easy to find and to clean, and they are often the gentlest choice for highly sensitive tissue. Silicone-based options tend to last longer and can be especially helpful if your dryness is more severe, or if you wish to avoid the need to reapply it often. Just be mindful that silicone lubricants are not compatible with silicone-based toys. Oil-based products may feel smooth to the touch, but they can sometimes disrupt the natural vaginal environment, and in some cases can increase the risk of infection. So I advise being cautious with those unless you are very familiar with how your own body reacts. One of my patients, Carol, aged 72, confided in me that she had almost completely stopped pleasuring herself because every single time she tried, it left her feeling sore for days afterward. She had simply assumed that this was a sign that her body no longer wanted or could tolerate intimacy. But when we talked further, I discovered that she had never once in her life tried using a lubricant. After I recommended a simple, high-quality water-based option, she came back to me smiling. "Dr. Stones," she said, "I honestly thought I had lost this part of myself forever, but with this small change, it feels natural again." That remarkable shift in her experience did not come from a prescription medication or a complicated medical treatment. It came from something as simple as respecting her body's new and evolving needs. Along with the issue of lubrication, another common mistake that women sometimes fall into is rushing the process or using too much force, thinking that if they just apply more pressure, they might be able to bring back the same intensity of sensation they remember from their younger years. But the truth is, with the thinner tissues and more delicate nerves that are characteristic of the post-menopausal body, that kind of force can completely backfire. I have seen women who have developed ongoing irritation, swelling, or even a temporary loss of sensation as a result of being too rough with themselves. Pleasure should never ever come at the cost of pain. A gentle, slow, and mindful approach to touch allows the nerves to respond naturally and helps to keep the blood flow steady without overwhelming the delicate tissues. Think of it not as a race to an end goal, but as a practice of giving your body the time and space it needs to respond in its own unique rhythm. What is so important to remember here is that your body is not betraying you. It is simply asking for a different and more compassionate kind of care. Intimate self-pleasure after 60 can still be a deeply fulfilling and important practice, but only if you respect the changes that your tissues have undergone. With the right kind of support and a gentle approach, it can even feel more relaxing and more deeply connected than ever before. So as you reflect on your own personal experience, I invite you to ask yourself, have you been skipping the use of a lubricant, or perhaps using too much pressure out of sheer habit? If so, please consider making this one small adjustment. Your body may very well respond with a level of comfort that you did not expect. When we begin to consciously shift from the habits of the past and into practices that truly support our bodies as they are today, the entire experience of intimacy changes from something that feels like a struggle into something that feels genuinely nourishing. There are very practical steps that you can take, both in the short term and for the long term, to make self-pleasure not only safer but also far more enjoyable after the age of 60. The very first thing to consider is preparation. Just as you would not begin a long walk without first warming up your muscles, it is incredibly helpful to take a few minutes to allow your body and your mind to fully relax. That might mean taking a warm shower to improve your overall circulation, taking a few deep, centering breaths to let go of any tension you might be holding, or even simply choosing a comfortable, quiet, and private space where you feel completely at ease. When your body and your mind are in a relaxed state, the flow of blood to the intimate area improves naturally, making both arousal and sensation much more comfortable. The second step is to give yourself full permission to explore new and different forms of touch. Many women tell me that they have been using the exact same technique for decades, but after menopause, the nerve endings in the body may respond quite differently. Instead of feeling frustrated that what once worked for you no longer feels the same, I encourage you to approach this as an opportunity for discovery. Try a lighter touch, slower and more varied rhythms, or focusing on different areas of stimulation. Sometimes women find that focusing exclusively on one single area can feel too intense, but that alternating between different spots can create a greater sense of comfort and a richer, more nuanced sense of pleasure. The goal is not to chase after a sensation you remember from the past, but rather to discover what feels right and good for you in the present moment. Another practical tip that brings both immediate and long-term benefits is the use of specialized vaginal moisturizers, or in some cases, local estrogen therapy, which your gynecologist can guide you on. Unlike lubricants, which are designed for use in the moment, moisturizers and estrogen creams work over a period of time to help restore some of the natural elasticity and hydration to the vaginal tissues. According to the Cleveland Clinic, these options can significantly reduce day-to-day discomfort, lower the overall risk of infections, and improve your intimate health. This means that when you do choose to engage in self-pleasure, your tissues are already better prepared to handle the experience comfortably and safely. Beyond the purely physical aspects, there is also a profound emotional element to consider. Many women carry with them a sense of guilt, embarrassment, or simply the deeply ingrained belief that this particular part of their life is now behind them. But consciously embracing self-intimacy as a legitimate and important act of self-care, rather than as something shameful, can completely transform your relationship with your own body. I had a patient named Maria, who at the age of 70, told me that she had completely avoided touching herself for over a decade. When she finally gave herself permission to reconnect with this part of herself, she said, "It feels like I am meeting myself all over again." That profound sense of self-acceptance is just as important for your health as any particular technique or product. It is also worth remembering that self-pleasure has a host of benefits that extend far beyond the realm of intimacy. Regular stimulation helps to maintain healthy blood flow, it supports the function of your pelvic floor, and it can even improve the quality of your sleep by reducing stress hormones. These are not insignificant benefits, they are powerful ways to support your overall well-being. And unlike many other health practices, this one requires no special equipment, no gym membership, and no set schedule, only your willingness to care for yourself. If you want a quick win tip that you can try right away, it is this. Pair your self-care practice with deep, mindful breathing. As you breathe slowly and deeply, your muscles naturally relax, your circulation improves, and your body becomes much more responsive. It may sound incredibly simple, but the act of combining mindful touch with mindful breathing can completely change the entire experience for the better. As we move forward, please remember this truth. Self-intimacy after 60 is not about proving that nothing has changed, it is about honoring the changes that have occurred and adapting to them with wisdom and grace. That very adaptation is where real comfort, safety, and pleasure reside. So let me ask you, have you ever experimented with new techniques, new products, or even just the simple act of slowing down? Or have you been holding on to the same routine from years and years ago? Please share your answer below. I promise you, other women will be nodding along, realizing that they are not alone. One of the most powerful reminders I have learned in my many years as a gynecologist is that intimacy after the age of 60 is not just about the body. It is profoundly about the story you tell yourself. I remember a woman named Elena, 69 years old, who came to me completely convinced that her days of self-pleasure were far behind her. She whispered to me that it always left her feeling sore, and she carried with her a quiet, deep sadness, as if she had already said a final goodbye to that part of her life. When I asked her to describe what she was doing, it became immediately clear that she had never once adjusted her routine since she was in her 30s. There was no lubricant, there were only hurried motions, and there was absolutely no aftercare. Her body was clearly asking for something different, but she had misinterpreted the discomfort as a definitive sign to stop altogether. We worked together on a series of small, manageable changes, introducing a gentle, water-based lubricant, consciously slowing down her pace, and adding a simple rinse with warm water afterward. When she came back to my office a few weeks later, her eyes lit up as she told me, "Stones, I truly did not think this was still possible. I feel like I have found a softer, kinder way to connect with myself." What struck me most about her transformation was not just that her physical discomfort was gone, but that she had regained a palpable sense of confidence in her own body. That is the incredible gift of safe self-care. It restores not only your physical comfort, but also your emotional closeness with yourself. I often use the analogy of a garden. When you are younger, your body is much like a garden that seems to water itself. It is lush, it is self-sustaining, and it is incredibly forgiving. But after menopause, the very composition of the soil changes, the air is drier, and the plants require extra dedicated attention. If you continue to treat that garden as though it were still self-watering, it will inevitably become brittle and dry. But if you begin to care for it with gentle watering, with nourishing soil, and with regular mindful attention, it can bloom with a breathtaking beauty that is even more meaningful than before. Your intimate health works in the very same way. It simply asks for a different kind of tending, not for abandonment. What I truly want you to take away from this is that adapting your habits is not a loss, it is an evolution. The experience of pleasure is not over, it just wears a different face. And when you learn to listen to your body with patience, when you respond to its needs with care, rather than with frustration, you will often find that the connection you feel is deeper, more mindful, and more profoundly healing than it may have been in your youth. This is precisely why ignoring self-intimacy or dismissing it as unnecessary can quietly take something precious away from you. It is not about indulgence, it is about circulation, it is about pelvic health, it is about protecting the integrity of your tissues, and yes, it is about joy. Safe practices are what keep that beautiful garden of yours alive and flourishing, no matter the season of life you are in. So let me ask you, when was the last time you thought of your own body with the same tenderness you might give to a cherished garden or a precious piece of your home? Have you been harsh with it, rushing it and ignoring its needs? Or have you been patient, gentle, and attentive? Reflecting on that very question can be the first powerful step toward transforming not just how you care for yourself, but how you feel about yourself. As we come to the close of this conversation, I want to leave you with a simple yet profound truth. Intimate self-care after the age of 60 is not something to be feared, it is something to be embraced. Your body may have changed, but that does not mean that pleasure or connection is gone forever. What it means is that your approach needs to evolve, just as every other part of your self-care routine does with age. We have talked about the 3 dangerous mistakes that many women make: skip the use of a lubricant, and thereby exposing already delicate tissues to unnecessary and painful friction, using too much pressure or rushing through the experience in ways that the body can no longer tolerate, and forgetting about proper hygiene afterward, which can leave behind an environment where irritation or infection can quietly develop. These may seem like small details, but they can carry large and uncomfortable consequences if they are ignored. By actively avoiding these common mistakes, you give your body the protection and the kindness it so richly deserves. The solutions, as we have discussed, are not complicated. They involve using a high-quality water-based or silicone-based lubricant to protect your tissues, consciously slowing down, trying a lighter touch, and truly listening to your body instead of fighting against it, and taking a few moments afterward to gently rinse with warm water to keep your intimate area clean and comfortable. These are small, deliberate acts, but they can completely transform your experience, turning something that once felt painful or embarrassing into something that is nourishing, safe, and deeply fulfilling. More than anything else, I want you to hear this. You are not too old for intimacy with yourself. In fact, the women who choose to lean into this form of self-care at this stage of their lives often discover a new depth of connection, a gentler and more profound kind of pleasure, and a renewed sense of confidence in their own bodies. I have seen it over and over again in my patients, and I want that for you too. So let me leave you with 3 key reminders. 1. Listen closely to your body. If something feels painful or unusual, that is your body asking for a different kind of care, not your body telling you to give up. 2. Be open and willing to adapt. What feels good to you today may be different than what worked for you 20 years ago, and that is perfectly normal and okay. 3. Think of self-intimacy as an essential and integral part of your overall well-being, just like healthy eating, regular exercise, and getting enough sleep. It is not just about pleasure, it is about circulation, pelvic health, emotional balance, and honoring your body at every single stage of your life. Before we close, let me remind you that this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care. If this conversation has resonated with you, I invite you to take the next step. Subscribe to this channel so you never miss the practical, science-based guidance I share for women over 60. Please share this video with a friend who may need to hear that she is not alone. And most importantly, leave me a comment below. Tell me if you have noticed changes in your own body, or if you have tried any of the safe practices we discussed today. Your words may be the very thing that gives another woman the courage to begin her own journey of self-care. Remember, your body is still yours. It still deserves your kindness, your patience, and your undivided attention. When you honor it in this way, you not only protect your intimate health, but you also nurture your confidence, your vitality, and your joy.